parents in some iteration becomes the gold standard for teaching nutrition education to young athletes. And so what I want us to do to start off is we're going to take and get in our time machines, and we're going to go back to like the mid 2000s. And two faculty that I worked with at Michigan State ended up becoming my co-advisors at one point, Dr. Joe Carlson and Dr. Joe Eisenman, had this idea of creating this laboratory setting for studying and improving the physical, mental, and emotional capacities of our young athletes. And with that, Spartan Performance was born. If you can see the shameless plug for the gear that I'm wearing today. And this was a brick and mortar speed, strength, and agility clinic that was created here in the Lansing area, where we had athletes coming into our clinic. We sent our staff out to different high schools to coach and to educate both the players and the coaches within what we called our integrated youth sports performance model, or this icon right here. And one of those pieces of the puzzle was nutrition education. And Dr. Carlson was recruited to Michigan State to help enhance and develop the nutrition program for our MSU Spartan athletes. And so we had these resources available that we were able to model and adapt for use in our clinic and for use when we went out to other schools. And I use the term infographic very lightly because, as you can see by the graphic here, there's more words than pictures on it. And so there was a lot of room for improvement, if we could say that. And the three of us, we all have a background in programming to school-based education, primarily in nutrition education, obesity prevention. And so we had this idea of combining all of these one-off lessons that we had into more of a substantial curriculum. And we reached out to one of our partners who ends up becoming my employer later on, Michigan State University Extension, and they also had a need for a new curriculum to add into their plan of work that also targeted an older adolescent population. And so with a little bit of grant dollars, we were able to develop the first version of Peak Health and Performance. And this is the version that was written into the plan of work back in 2015. This was also the version that I used as part of my dissertation study to really test the effectiveness of this. And then throughout my research and through feedback from coaches and our extension educators, we found that we could play around with some of the information that we had. We could combine it in a little bit different strategy, and then also add in some new components to really make it a little bit meatier. And so we're currently in our second official version of this, and this will be the version that we will kind of highlight later on. So again, I just wanted to, again, give credit where credit was due in terms of who helped to create this program. I often refer to this as my nutrition program because I get to run point from MSU Extension standpoint, but it definitely took a village to raise this baby. And so before we get started, I want to just get a sense from those of us on the call today in terms of, how we feel about the importance of nutrition and our current confidence in the knowledge. So Lynn, if you could launch poll number 1 for us, please. It's just 2 simple questions. We want to kind of see where you're at, and I would ask that you answer as honestly as possible. Got some results coming in already. I love this real-time data collection. This as a program evaluator, I wish I had something like this, 24/7. All right. Getting a pretty standard dispersion, about what I would expect for question 1. And definitely for question 2. Okay. Good. Then this talk is going to be very fruitful for all of us, because I think that this is going to hopefully shed some light, especially for that question 1 where some of us are not really sure about what kind of information that we should be providing for our athletes, if at all. But it's good to see too that a vast majority of us find that nutrition is important. So I thank you for your feedback for that. So again, why are we talking about this? Why is this an integral part when we're talking about a holistic improvement in our athletes' lives? Well, if we take this 50,000-foot view, and we just look at nutrition behaviors of adolescents in general, we see that a majority of them fail to meet the mark for meeting nutrition standards for our dietary guidelines. We see a vast majority of them are under consuming those nutrient dense foods, those things like fruits, vegetables, and whole grains, those things that mom and dad always tried to get us to eat when we were kids. We see an overconsumption of these empty calorie foods, things like candy, sweets, and sugary beverages. And we also see a good proportion of them are missing or skipping meals, particularly breakfast. And we know from the literature that these types of behaviors increase your risk long-term when we get into adulthood for things like chronic diseases, like heart disease, diabetes, and those types of things. And so if we're seeing this at a young age, we know that we have an opportunity to go in and with a little bit of a deficit reduction approach to try to improve these behaviors in our youth. But if we take that one step further and we want to say, okay, well, what about athletes, right? They're health-minded, they're being physically active, they should have, just by their nature, better nutrition, right? Well, what we know from the literature is that there's very limited research on non-elite adolescent athletes. Much of what we get is going to come from across the pond, where you have a little bit more of a closed environment, where you have kids that are in academies that have training tables and cafeterias and those types of things. But what we can ascertain from the existing data is that on one hand, we do see marginally better consumption of things like fruits and vegetables, still not meeting those guidelines, but they are slightly better. And we do see more frequent breakfast consumption. But on the other hand, we also see that athletes tend to have higher fast food consumption and higher sugary beverage consumption, which again, if we take a practical step back and look at this, think of our typical like middle school or high school athlete that might have siblings that are also playing sports and mom and dad carting them around to practices and games. It's really easy to stop at fast food in between rather than trying to get those home cooked meals. We also see that athletes report use of dietary and supplement use. We have a multi-billion-dollar industry in the sports supplement industry that highly targets this particular market. All right, so we also see that there's opportunity to improve not only some of this, but also just to try to, again, on a broader scheme, improve some of those dietary behaviors as well. And the results with this would be really twofold, right? On the one hand, following these dietary guidelines helps to provide adequate energy for normal growth and development. Our teenage athletes are in that time of transition from childhood into adulthood. Their bodies are growing, they're maturing, and it's a time where they need more energy than any other time in their life cycle. And again, we've talked earlier about maintaining these healthy eating patterns helps to reduce the risk of some of these chronic diseases. Now that's all well and good, but it's really hard to get a young person to think about these long-term consequences of their eating habits, right? And so we can also kind of play this in terms of how it's going to help them here and now, particularly with their sports participation. So following these dietary guidelines helps to provide adequate energy for athletic performance. One of the examples that we use when we teach peak health and performance is if you go into practice or competition with an 80% full fuel tank, one of two things is going to happen. Either one, you're going to be able to give 80% effort for 100% of the time, or you're going to give 100% effort for 80% of the time. Neither of those is going to help you really optimally achieve your performance. And so we want to make sure we're fueling ourselves properly before and after exercise, but throughout the day. It also helps to aid in that recovery from exercise. So when you leave it all on the field or you leave it all in the weight room, you're able to replenish those fuel stores and you're able to rebuild that muscle bigger, faster, and stronger so you come back the next day ready to play. It also helps reduce the risk of injury so that you're not watching your teammates while you're on the sideline and they're outperforming. So we kind of see this twofold approach of why it's important to establish these behaviors early on, especially in our adolescent athletes. Now, there are programs that exist primarily in the school and the community setting that have tried to tackle this for youth and adolescents in general. And what the data shows us with this is we really haven't found that silver bullet in terms of how we're going to effectively do this. We see that some programs will show these short-term improvements, but on the long term, there's not a whole lot of existing data that shows that this program or that program is excellent compared to another. And so when we looked at this, we knew that we had this opportunity to improve upon the delivery mechanism with this, but also to shape the message specifically to this adolescent population to make it more meaningful to them. And it just so happens that sport has been identified as an alternative to school-based programming because it has this potential to create this optimal learning environment. And I say potential because we do have to work to set it up to make sure that our athletes are there, they're primed and ready to learn, they're excited. It's one of those things they get to be with their friends. And by tying this directly to their identity, because adolescent athletes strongly identify with their alter ego as an athlete, that if we're showing it that that's going to help them or improve that particular area of their life, they're more likely to kind of key in with this. We also have built into this environment a built-in champion in the way of the sport coach, which has been identified as a main source of information. But we also knew that a lot of our coaches, particularly in our case, where we're dealing with a lot of volunteer coaches or mom and dad that just happen to have the more flexible schedule to be able to show up and run practices, they're not really equipped with the right information, the right knowledge. They have no formal training in this. And so as we were creating, the model for delivery of how we were going to put this together, we wanted to make sure that we were keying in both on the coaching standpoint to make it user-friendly, but also the athlete standpoint so that it was something that was quick and easily digestible to them, but also something that resonated with them so it was something they would take with them. So with that being said, I want to open up our second bit of questions right now. This is a short 6-question survey. I pulled these directly from the questionnaire we used with my dissertation. And it's just to get a sense in terms of some of these general and sport-specific nutrition recommendations. I just want to see from this particular group how well we do with this. So don't shame yourself if you don't get it right. I just want to see kind of where we're at with this. So Lynn, if you would launch the second question, please. And no Googling the answers. This might be an open note, but let's not cheat on this.
Hey, RJ, are these for just kids or are they for adults too? Just curious.
This is targeted toward an adolescent, so somewhere between about 13 and 18 years old.
Great, thank you.
Mm-hmm.
And RJ, I guess kind of a follow-up question to that is, are the differences pretty significant when you're thinking about under 13, like more children playing in sports and stuff?
Some of the recommendations that we might give or things to focus on might be a little bit different. As we're working with adolescents that are trying to transition more into that independent young adulthood, we're working a little bit more on their choices in terms of some of these specifics, but we're also taking into account like the level of competition as well, where we're starting to see, as you're starting to get older, you may start to specialize in 1 or 2 sports, you start taking your training a little bit more seriously. For the younger kids, really, it's more of just general nutrition recommendations. There aren't a lot of sport-specific recommendations for a very young age because it's sampling, it's fun, they're still growing. And so really what we just want to make sure is that they're getting a very nutrient-dense eating pattern throughout the day. All right, I'm seeing you guys are knocking this out of the park. I appreciate that. He has a few more minutes. All right, we'll go 30 more seconds. At 3:30, we'll go ahead and shut it down. Final answers, please. All right, and time's up, pencils down. All right, so looking at this, yeah, the first question, you guys did a really good job. It depends on the age, gender, and sport and training position. Really, there's, and we make sure to emphasize this in our education as well, is that this is set up as a model of more of a health education standpoint. So we're not giving individual specific recommendations for caloric intake or any of the macronutrient intake. So yes, it does depend on the age, gender, and sport and training program, right? And we'll talk about that a little bit. We talk about our lesson 2, athlete performance plates, and how we can increase or decrease portion sizes based on our easy, moderate, or intense. Regarding water intake, athletes should drink, yes, 8 to 16 ounces of water before an activity, or 4 to 6 ounces every 15 minutes. There's also, you can follow the 4-3-2-1 principle. 4 cups of water, 4 hours of 4. If you don't do that, 3 cups of water, 3 hours of 4, incrementally down until you're doing that. And then, yeah, usually about 4 to 6 big gulps of water every about 10 to 15 minutes or so, which we can modify this if it's really hot, humid, or if you have athletes that are excessive sweaters. Vitamin and mineral needs, eating a balanced diet, very good. Carbohydrate should be consumed, all of the above. Carbohydrate, main source of energy for the moderate to intense exercise or most of our sport plays. So we want to make sure that we're getting carbohydrates throughout the day. What percentage does dehydration start to decrease performance? 1 to 2%. That's primarily an anaerobic exercise, but you will start to see decrements as early as 1%. And usually if you're starting to feel thirsty, you're already about 1% dehydrated. What types of foods included in the greatest number of servings per day? Ooh, we see a lot of meat eaters out here. Protein is important. However, if we are in an isocaloric state, meaning that we're getting enough calories to meet our energy needs, we're pretty efficient at downloading and using protein. So we want to make sure that things like cereal, pasta, and fruit, or those complex carbohydrates, are in our diet. So I will applaud you for doing better than our set of volunteer coaches that we did our study with in terms of answering these. So, but again, that's just to kind of give us an idea of some of the topics that we cover and how we, again, we really nail it down to brass tacks. And so going into the curriculum design and implementation, again, I want to shamelessly plug our publication that went out in the Sports Journal back in February, which actually is the reason that I am here today, because it got into the right hands in terms of being used as a marketing tool. But this article that I wrote with my colleague, Dr. Tyler Becker, we go through a lot more in depth of the rationale for the development of peak health and performance. And we also go through each individual lesson, really spelling out the main learning objectives and everything else. And so if you want a quick and easy read, it's open access. I highly encourage you to go and check that out. But again, peak health and performance was created to be a mode of education, not only for our coaches, but for our athletes and for our parents as well. And we really wanted to leverage this idea that sport is this vehicle for life. And so we wanted to make it as fun, exciting, and as engaging as possible. And so we structured it to make sure that we were hitting all of the major talking points of sports nutrition, which we were able to kind of identify into these pillars of peak performance. So when Spartan Performance was a brick and mortar speed, strength, and agility clinic, we kind of took on this Greek mythology theme, kind of playing off of the MSU Spartans. And so I wanted to carry that forward kind of as an homage to, all the folks that helped us out. But this graphic here really kind of represents what the program is and what our philosophy is in terms of, being able to achieve peak performance. And you'll see at the bottom, in terms of the foundation, we have hard work, consistency, and fun, which I would argue is the foundation to be successful in almost any endeavor that we take on. It's something that you have to work hard for, right? We actually have to put in some effort to try to get that outcome that we're achieving. We also ask for consistency. We know that perfection is not an option, but if we're consistently making those baby steps forward, we're going to be better each and every day. And then finally, fun. That's the linchpin that really helps to make sure that we have this longevity, and it's something that we're going to stick with. And so again, we keep that as our foundation. And then in terms of our pillars of peak performance, these are the key components of nutrition that really arguably would be for almost any population. And so we teach the notion of energy balance, portion size, timing of intake, and hydration. And if we're following those best practices within those 4 pillars, it helps to hold up what it is we're trying to achieve with our nutrition in sports, which is optimal performance and optimal recovery. And so again, this is just a really cool visual to represent really what peak health and performance is. In terms of the recommendations that we give, the general nutrition recommendations come directly from the USDA dietary guidelines. We use the USDA MyPlate as a jump off point. And as you can see by the graphics here, we increase or decrease portion sizes based on our training level. When it comes to the sports specific nutrition recommendations, things like frequency and timing of intake, hydration, supplement use, we have a collaboration from several different position statements that exist here in the States and internationally as well. And again, this is to give more of those general behavioral recommendations, not the individual recommendations that you would find in there for things like macronutrient intake and those types of things. We rely on the general nutrition information with that. And so with this, you don't have to be a registered dietitian to teach and to provide this program. It's made for a community health focus in mind. And we package this in a 6-lesson format. Again, building on those pillars of peak performance, and then having a bit of an application at the end, and then my made-for-TV movie moment in the lesson titled More Than a Game. So in nutrition basics, the main focus with this is we want kids to get this idea that food isn't just something that we eat at meal times. It's not just something you eat that tastes good. We want kids to get this idea that food is fuel and function. And so we go over the role of macronutrients and why it's important to get the right amount of protein, carbohydrates, and fat in their diet because of what they help to do to our body to help perform and recover optimally. We also promote the idea of energy balance here, where the energy that we're getting in from our foods helps to match the energy that we're expending with our daily activity as well as our sports activity as well. So we don't try to encourage weight gain. We don't try to encourage weight loss. We try to encourage this idea of matching your energy intake, which again has some long-term benefit to that as well. So we're really trying to give ownership to these athletes so that as they get older and as they start to transition out of their competitive state and they're more recreational, that they have this idea that, you know what, I don't need to have these big portions. I'm not being as active as I used to be, and I can kind of eat accordingly. In lesson 2, athlete performance plate, we start talking a little bit more about our portion sizes, again, using that USDA MyPlate as the jump off point. And using that as an example, saying if this is just an easy training day or it's an off day where you're not doing anything but just your daily physical activity, you're going to get adequate energy and nutrients by following these proportions. Once we start getting into our normal competitive season, our regular practices and competitions, we might bump up to our moderate plate, where you're going to see the plate gets a little bit bigger and our portion sizes of carbohydrates are going to get a little bit bigger than that because, again, that's our main source of energy. And then when we have those grueling 2-a-day practices, we have the all-day tournaments, we might even jump into the hard training plate, which we'll see is like, you know, almost 50% of our grain group. We're getting a lot more fruits and vegetables again. So again, it just kind of shows how we can increase or decrease those portions. Timing of intake, now we're talking about the 3rd pillar where we want to try to eat throughout the day, focusing on some of those important times. It's really important for an athlete, namely breakfast, pre-competition, and post-competition. You know, talking about the need to top off your energy stores before you're going into a practice or game. And then right afterwards that we're getting something in to make sure that we're refilling our energy tanks, but we're also starting that recovery process. In lesson 4, we talk about hydration and we take those principles of what to eat, how much and when, and we apply it now to what to drink, how much and when, right? So we're promoting water and low-fat dairy as being your optimal choices. We talk about how to monitor your hydration, which always gets a chuckle because we have a pee chart and we ask kids to monitor the color of their pee in the morning to kind of gauge where they're at. We're also talking about how to recognize signs of dehydration and making sure that, again, we're following these principles of carrying a water bottle, having those regular water breaks during practices and stuff to make sure we're on our A game. In lesson 5, this is a bit of an application where now we're getting into more these food resource management components, where we're identifying the need to make sure that we have these healthy ingredients at home so we can make these meals and snacks that we were just talking about in the previous lesson. So we talk about the need to make a grocery list and working with mom and dad to talk about these healthy recipes and actually getting hands-on in the kitchen to make some of these. So now we're learning some of those life skills as well. We also talk about, if you are going to, stop at a convenience store or a fast food restaurant, what are some of the healthy choices and how to identify those healthy choices on a menu. Now, this is a little bit of you can lead a horse to water, but again, we want to put that in the hands of our athletes and help them to make the right performance play. And then, as I joked earlier, the last lesson, more than a game, this is where we get our athletes to kind of take this introspective approach and think about all of the different skills and all the different benefits they've got from participating in sports, whether it's how to overcome adversity, how to set goals, how to have better time management skills. But we also get them to identify different components of their sport that really draws them into wanting to play, whether it's being with their friends, if it's just, how they're being physically active, so that when their competitive days are over and they're searching out other activities to do, we're promoting this idea of lifelong physical activity and really leaning on this LTAD model, or long-term athlete development, of being cradle to grave. And so we package these together to kind of build upon one another, to kind of lead them to the finish line and see them go. Along with the in-person lessons, we also have a video series that was created for this. That is we have now 10 videos that accompany each one of these different lessons. If you remember back to our time machine example earlier, the original peak health and performance curriculum, we started off at 8 lessons, and through our first process evaluation, we truncated that down to 6. And so the original versions of the videos kind of match that earlier format. But we have 10 videos in this right now. They're 3 to 5 minutes long. And I want to share with you one right now that gives a brief summary of all of the nutritional components that we've talked about, just to see kind of how simple and easy it is to deliver this message.
Being a great athlete means more than just being the fastest kid on the field or the strongest kid in the weight room. Being a great athlete means you take care of your body each and every day. And one of the ways that we can do that is by making sure that we're fueling our bodies properly, making sure that we're eating the right types of foods in the right amounts and at the right time to optimize our peak performance. We do this by making sure that we're eating the right portion sizes of carbohydrates, proteins, and fats throughout the day. One easy way to make sure we're doing this is to look at the USDA MyPlate as our reference and increase or decrease our portion sizing based on easy, moderate, or hard training days. It's also important to make sure that we're eating throughout the day. Remember that breakfast is the most important meal, and we want to eat within 30 minutes of waking up. Also, first thing in the morning, we want to make sure that we're checking our hydration status by looking at the color of our pee and making sure that we're hydrating each and every day throughout the day, either carrying a water bottle with us or taking a drink every time we pass a water fountain. Also, we want to make sure that we're packing healthy snacks with us so we can eat every 2 to 3 hours to make sure that we're maintaining our energy balance. And remember that we want to try to get in that power hour, which is eating a meal within 60 minutes of a practice or competition to make sure that we have enough stored energy to go out there and perform. And we want to make sure that we're eating within 60 minutes after a practice or competition to start that recovery process. It's important to make sure that our bodies are replenished and refueled so that we can get up the next day and do it all over again. As athletes, you can think of your body as a high-performance sports car. And in order for that sports car to run at its best, it needs to be fueled properly. And in order to do that, we need to give it high-performance fuel. As athletes, we get this from things like whole foods, not from pills and powder.
So not to brag, but I did do that in one take. I was able, it was one of those where, again, I kind of helped to write the script. And so I'm throughout some of these videos. Dr. Eisenman's in there as well. Drew Coker, who was our MSRD at Spartan Performance, he's in a couple of them as well. And so you get a couple of different faces to that, but I didn't want to volunteer them to be part of this, so I kept on it as well. But each one of the videos has that same intro, it has the same outro, and it also, each one of them has one of these summary pages at the end, which work really well to, again, use it as either a jump off. If you're going to use it to teach the lessons, it's a really good review. And again, it's a, you know, we were able to cover basically everything you need to know about nutrition in 3 minutes or less. So it's a really good complement to what is the in-person lessons. Go to the next slide. There we go. Each lesson does contain a facilitator guide and an athlete handout, which anybody that delivers peak health and performance goes through a training. It's anywhere between about 60 to 90 minutes. It depends on how many people are in the training, how many questions we get. But we walk through some best practices in terms of working with our athletes and working with coaches to create partnerships and to create those expectations so that we're setting ourselves up for success. And then walking through each one of the lessons, going over the main learning objectives, giving some really specific examples to how to explain a couple of different things, and then sending them on their way. For this version of it, we added a little bit more to the athlete handouts to make them a little meatier. In the original version, they were more of a fact sheet and just kind of more information giving than anything else. And we added a couple of learning activities with these so that for our needs, especially at Extension, that we could do a little bit more hands-on education with them. It also helps to spend a little bit more time in each one of these lessons. We're also working on right now a recipe guide for these so that we can have resources for coaches, athletes, and parents for those healthy meals and snacks, particularly around pre and post workout nutrition, and also breakfast as well. So that's something that we have that's currently in the hopper. And in terms of our implementation strategies, there's a couple of different ways that we've been using peak health and performance to reach our athletes here in Michigan. The first of which is using it just as your bread and butter 6-lesson series. And this is delivered usually 1 or 2 lessons per week, either before or after practice. And really it's up to in our instance, it's up to our educators and our coaches to kind of come up with what's going to work best for their schedule. Because we know that time is more valuable than gold when it comes to practice time and time with our athletes. And so we want to make sure that we are being as complementary as possible to the needs of the coaches, and so that we are being a benefit, not a burden to them. We do it either as an individual team or we do it assembly style. When I was teaching this with one of the high schools I was working with in the Lansing area, we brought down all of our spring sport athletes to the auditorium right before practice, so that coaches and teams sat together, we went through the lessons, and then they broke off into their individual practices. And this helped to keep my one-man dog and pony show to be in about 8 different places at once, because otherwise I'm running out to the soccer field, I'm running out to the track, I'm running out to the ball diamond, I'm running down to the weight room to catch their athletes where they're at. And so again, we definitely work with our schools and our teams to make it fit their need as much as we can. In terms of the videos, we do encourage them to be used in the lesson. Again, it works as a really good jump off point because you can use some of those examples as some of those key messages as you move forward. Or you can use it as a homework style, where if you don't have a whole lot of time in the particular session that you're teaching, you can do it later on during the week. Again, as kind of a reinforcement, but it also works really well for the parents to be able to get some of that education as well. And so for lesson time, it takes at minimum about 10 minutes. But lessons can take upwards of 25 or more. Again, it all depends on how much time you have available and if you're using all of the different learning activities that are included within each lesson. We also leverage the opportunity to do one-time presentations. And for us, this works really well as a marketing and advertising tool. Whereas, you might have an organization that doesn't want to commit fully right away, but is interested in learning more about your program and what's included. And so we can kind of customize these talks to come out and talk to all the student athletes in general. It doesn't have to be season specific. We've also used this really well with some of our summer camps. And so one of the other arms of extension is our 4-H program. And so they do a lot of summer camps with athletes, particularly around soccer. And so it's a really good way to fill in some of those 8-hour days they have with the athletes, and being able to bring the iPad right down to the field and deliver some of these lessons, get some of the feedback from them, and really engage them. And then the last piece of this, these policy systems and environmental changes, these can work either by themselves or in concert with either the series or a one-time presentation. And this really are these changes behind the scenes that help to either improve the environment to allow for some of these behaviors to happen, or reducing barriers that are preventing athletes from being able to fulfill some of these. And so one of the best examples of this is, for our athletes, we're encouraging them to carry a water bottle with them and drink water throughout the day. Well, some schools have a policy of no food or drink in the classroom. And so right there, we're already up against a brick wall sometimes when it comes to, how do we get around that, or how do we come up with a solution for that? Other things that we have done is with a partnership with the United Dairy Council of Michigan and their chocolate milk grant, is where we've actually gotten coolers and put them in the locker room or in the weight room and keep them stocked with chocolate milk, because that works as a really good post-workout nutrition. And so now we have athletes, as soon as they get done with practice, they know that they're going to the cooler, grabbing a chocolate milk. Whether they've gotten the lessons and they know why they're doing it, we're still enabling them to do that by changing the environment. And this is what really helps to create that long-term sustainability, and creating an environment that, again, promotes a lot of these behaviors that we're trying to get our athletes to adopt. And so if I could tell you the best way to do it, or if you could kind of design your Cadillac version, it would be a combination of your direct education and your policy systems and environmental changes that evolve and grow organically within the organization that you're working with. And in terms of who can participate with this, again, the program was designed to take as broad a brushstroke as we could for all adolescent athletes. And so again, our nutrition recommendations, portion sizes of those kinds of things are targeted towards that middle school, high school aged athlete that is involved in any sport. Even got the question, I was at our national FNIP conference last year and was getting the question about things like marching band, things about color guard. Absolutely can work with that, right? It's still a team environment. They're still going through physical training. We may have to adapt some of the examples that we use, but it is absolutely applicable to that particular audience. And it's applicable to all levels of athletes, everything from your recreational athlete all the way through your elite and travel teams. Any athlete, any adolescent athlete can benefit from participating in peak health and performance. And so now I just want to take a second and show you some of the outcomes that we've seen from using different versions of this, and kind of where we're going at moving forward. So we'll look at some of the results from my dissertation research, and then also some of the program outcomes that we've had from our athletes at Extension. And so my dissertation was broke up into 3 different aims, the first of which was the meat and potatoes of it. It's how well does this curriculum go up against a control group, which got our mental skills program that we also have available, shameless plug, within the umbrella of peak health and performance. And so our big thing was to figure out, knowledge, behaviors, and self-efficacy related to general and sport-specific nutrition recommendations. And what we found was that in terms of our knowledge and self-efficacy, our sports knowledge and our self-efficacy related to general and sport-specific nutrition recommendations were significantly improved in our treatment group compared to our control group. And this is very intuitive because, again, a lot of the general nutrition knowledge that's present in health classes, that's present in other programs. And so we would expect that to be a little bit stronger in an adolescent population in general. So it was nice to see that we were able to improve at least the knowledge of some of the things we wanted the athletes to know specific to those sport-specific behaviors. In terms of consumption, we did see a significant improvement in whole grain consumption, not a whole lot across the board. Again, some of this was just in limitation with our sample sizes as well. Off the record, it was a real pain to try to recruit the number of cold calling athletes and coaches to participate in this. So again, that was kind of a limitation behind the scenes. And then finally, looking at some of just the behaviors over the time, we didn't see any significant improvements. But the one thing that you'll notice from some of this, particularly like around breakfast consumption and meal frequency, is that you had athletes on both sides of the fence that were already pretty high in terms of the scale that we were using. So we might have run into a little bit of a ceiling effect with that, with not a whole lot of room for improvement. And so again, we have in the hopper an opportunity to replicate this study with our new version of Peak Health with a much larger audience than that. So we're hoping to kind of take a much deeper dive into the overall effectiveness with it as well, and with a wider breadth of backgrounds, ethnicities, and ages of athletes as well, to make it more generalizable. And in terms of just our standard program evaluation through MSU Extension, with our 2 grant funding that I mentioned earlier, our SNAP-Ed and FNAP, we have a standardized survey that we use for all of our youth and all of our adults as well. And so data collected from our participants in Peak Health and Performance used either the FNAP 6th through 8th or 9th through 12th survey. It's a 14-item survey that gets at fruit and vegetable consumption, physical activity, and things like food safety. And then we created an additional subset to get at breakfast consumption, pre-post workout consumption, and those types of things. And again, we can see that we are moving the needle north on some of these. And again, these percentages don't really mean much because we're not doing it, comparing it to a control group. So in terms of effectiveness, but we do see improvements in some of these key areas. But this also has led us to some really good process evaluation data in terms of delivery, in terms of some of the examples that we use. So everything that we're collecting is helping to improve the program in and of itself. But we don't just collect just quantitative data, we also get qualitative feedback as well. And one of the success stories that I'm really proud of, we got this last year from a group up in Traverse City, which I'll be a Michigander for a minute, and it's up in this area. In partnership with UDIM, we're able to get Justin Abelcator to show up on a Zoom meeting with them. Justin Abelcator is a former MSU Spartan, played for the Detroit Red Wings back when they weren't getting beat like a drum almost every other game. But he was there to do some Q&A with the kids. He was there to reinforce a lot of the messages that were being, that we delivered through Peak Health, saying things like, man, I really wish I had something like this when I was an athlete. And so again, it's, not every program can get a Justin Abelcator to show up, but we get a lot of success stories from coaches just saying like, just seeing the spark in their eye of their athletes when they get, they get that realization or that understanding where something works. And so again, there's a lot of behind the scenes stuff that goes on that's showing that we're at least moving in the right direction with this. But I'm somebody that I'm never satisfied. And so we're always looking to improve. We're always looking to hone our craft, which leads us in to the last piece in terms of where do we go from here? How do we make Peak Health and Performance the gold standard? And really the biggest thing is just getting it out in a wide audience, in getting folks that are much more creative than I am, that are much smarter than I am, that have more experience and more connections in communities to test this out with their athletes to see how well it works, to make it as generalizable as possible. So this is everything from getting in with local teams and schools and organizations and just seeing how well it's adapted, how well it works. Getting in touch with sports-minded organizations, wink, wink, nudge, nudge, on the call today in terms of, okay, how can this model be successful? Or what have we done in the past that might help this model be more successful? Looking at other regional partners and colleagues, former athletes that now run a business that have a pocket full of money that are willing to invest in a community organization and how we can get it to work. And it's really thinking outside the box. Again, it's getting into a room with very creative people and presenting an opportunity, not a problem, but an opportunity, and saying, how would you solve this if you had a magic wand? And that has led to a lot of open doors, that has led to a lot of great conversations. And I'm really excited to open the floodgates up in this group as well to hear what you have. So with that, I want to thank you all, first of all, for coming to this talk today, for giving me an opportunity to gush as a proud parent should of a child he's seen grow up into this adolescent, shameless plug included. And I want to open this up to questions, suggestions, anything you want to get off your chest. And also, if there's anything that you think of later on after this, please feel free to email me. My email is right here on the screen. I'll make it available in a chat or email or however you want to get it. The videos, I'm going to get that question, where are they at? SpartanPerf.com. It is free to use for anybody. They are out there. You can use them right now. They are available and use on any format via laptop, iPad, phone, does not matter. Go check us out. So thank you. And I want to open it up to questions that you might have.
I have a question. I'm curious, like, how can we support adolescents who live in communities that like experience poverty or like that live in food deserts and things like that, and making sure that like they're adequately meeting their needs, even if it's might not be like food that we consider quote unquote healthy and things like that.
Megan, that's a great question. And actually, some of the funding, or actually a very good majority of the funding that went into creating Peak Health and Performance came from our SNAP-Ed and FNET funders. And so all of the information, examples, and resources that we have are made with a low income population in mind. And so we're not saying that you need to go out and get filet mignon and baked potato. We're providing, again, that blanket resource of what should be your, how do we build your performance plate, and then knowing what we have in our communities, which I said before, like you will know your communities better than I can, and saying this is how we can meet that by going out and getting this, these certain meals at this particular restaurant or shopping at this particular supermarket. We've also had success with getting local partners to help out in donating foods to schools. In our area, using Jimmy John's, we had a coach that would get every morning coming into school would get the day old breads, keep it in their office and use that and have lunch meat available so athletes could make sandwiches if they didn't have food available. And so, yeah, we make sure that, again, as we're providing these recommendations, that we're not being specific to types of foods. So like if we're telling kids to eat more fruits and vegetables, we're not discriminating against fresh, canned, or frozen, right? Vegetables are vegetables, fruits are fruits. However you can get them. This is how, this is about how much you should have, and this is how it's going to benefit you.
Awesome. Thank you so much.
Mm-hmm.
Thanks for the thoroughness of this presentation. It's really helpful on many levels, especially as we're looking at how to design our own curriculum around specifically sports and youth development. So my question is, how do you know who's completed the curriculum going forward? And do you recognize people for hitting the milestone? I guess athletes who may have taken all 6 courses, is there some way that you acknowledge or motivate them from course 2 to course 4 to completion?
That's a great question. So the model that we use, especially in our state of Michigan, is our instructors will go out and they're recruiting either at the school level or at the team level, and getting them to say, okay, I want you to come out to my track and field team. I want you to come out to my basketball team. And so we're doing it as kind of a group environment. The educator comes in after the basketball practice, sits down, all the athletes are already present. And so they're running through it that way. We also do pre and post evaluations with them. So that would be another way we're tracking their attendance. But we also have these, what we call our nutrition education reinforcement items, or NERI, that we use kind of as an incentive, saying, if you're showing up, you might get a water bottle, you might get something else with them as well. And so a lot of that is we're kind of handcuffed in terms of incentives that we can provide based on our grant dollars and what we can and cannot purchase. But there are definitely opportunities to, like for instance, one of the partnerships that's on is just ready to go off right now as soon as we can get in-person education, is having, team t-shirts made and water bottles made and drawstring bags made, or, thermal coolers made so that kids can pack healthy meals and snacks and keep hot foods hot, cold foods cold, and those types of things. So there's definitely lots of opportunity for that. A lot of it is just, again, like, we have to work within our confines, at least with our grant dollars. But a follow-up question or a follow-up response to that too would be, in that Cadillac version that I mentioned earlier about not only your policy systems and environmental changes, but also your direct ed. So the idea would be, like, you might have a freshman in your high school that now is a junior and it's gone through 2 iterations of this. Well, now you can champion that junior to be a leader, to be a role model, to be a mentor, to even do some of the education themselves. And so now you're providing that athlete with an opportunity to bolster their autonomy, to be a leader and to showcase their knowledge, and to kind of give those different roles and stuff too. So there's a lot of different ways that you can make that work, depending on the environment and depending on the resources you have available.
Hi, RJ. Actually, that's a great kind of transition to my question. I was curious about, like, how much of the curriculum maybe lends itself to the kids, because I know it's targeted towards middle and high school kids, but them actually, like, going home and implementing these changes in the household.
Mm-hmm. Yeah, so your last bit of question broke up.
No, it's okay. Go for it. I think you got the bulk of it.
Yeah, so the athlete handouts that we send back with the kids, if we're giving examples in terms of, trying to eat breakfast within 30 minutes of waking up, we have specific examples of what could be used as some of those, like, on the go things. Like if you have to be out of the house at 8:05 and you wake up at 8:03, like how you set yourself up for success for that. What are some of those pre to post workout nutrition things? We have those on there. We also give some of the examples in the videos as well, for take homes. And then one of the things that we're currently working on right now, like this playbook that we're putting together, we'll actually have recipes for some of those meals and snacks. So it'll give some of those other resources for those parents to know, like, if my kid wants a smoothie after practice, what would be the correct proportion of ingredients to make that and put that together. So that's something we are working on.
Cool, thank you.
Mm-hmm.
Paul, you're muted. I think Paul, you trying to say something? You muted.
Yeah, I'm sorry. RJ, the CAP program that you mentioned for Michigan, where there's 9 different required courses, what are those? And are you guys required outside of the Michigan community, like your own nutrition program? Is it part of CAP, or what is that whole system in a nutshell?
Yeah, that's so the requirements for coaches, each CAP course has 3 different modules in it. So it's a 6 to 7 hour basically weekend that you're in the training. Coaches are required to have certification through CAP 1 and CAP 2. And so we go over things like legal responsibility, psychology of coaching, basic first aid, those types of things. A lot of that's kind of CYA for the coaches. And with that, as a value added, for every level of CAP that they get certified, it's a 1-year, $1 million insurance policy for their school. And we have upwards of 9 levels right now. So like our Michigan State University is the Institute of Study of Youth Sport. Another shameless plug for you all, is doing our summer coaches school coming up in June. And part of that signing up, you can get continuing ed credits toward CAP certification. I think that's CAP 7 and 8. But other things that we talk about. So I do psychology of coaching is one of the ones that I talk about. Effective leadership, effective communication, conflict resolution. And then to your question, is nutrition included? Yes. One of my kind of inroad with the MHSAA was also a colleague. He was also on my dissertation committee. Dr. Tony Moreno was an instructor for them for many, many years, still is, and knew that one of the modules in CAP 5, Healthy Living, needed to be updated for their nutrition recommendations. And so it's eerily similar to the information and graphics that you're going to see in CAP 5 in that particular lesson. There's no endorsement yet. I'm working that angle so hard right now from the MHSAA to adopt peak health and performance. But the information that they get in healthy living or healthy lifestyles is directly related to this. And I'm one of the only instructors, if not the only instructor, that teaches that particular one. So I am constantly referring folks into Peak Health from that module.
Is Peak Health free?
Okay.
Is Peak Health? Can you hear me, RJ?
I can't now yet.
Did I go out? Okay. Is Peak Health like access to all the course materials and everything? Is it free?
It is. All be, based on our grant dollars through SNAP-Ed and FNAP, all of the information or the resources available are free. We are in the copyright process as we speak to make sure that the products and materials are not adapted, changed, or plagiarized in any way or shape or form. So we are working it that way. The videos are free as well. It's the training, the implementation, the other resources and stuff. You get those directly through us. And if that's something that you're interested, we can talk offline about that in terms of how we can set that up.
Hey, RJ, I had a question. This was some work I did in a couple of public health school classes, and I was wondering, does your curriculum or just your program in general speak to sort of the gender aspect of nutrition related to sort of like the female athlete triad and those type of things?
That's a great question, and that's actually one of the additions that we were working on, saying that we're always improving. So we are creating an additional, it's what we call our one-time presentations. We're creating one specifically around the female athlete triad. And so we will dovetail for folks that want that specific or have that specific need. We'll have that available, but we don't directly assess it in any of the programs or any of the 6 core lessons, I should say.
Great, thanks. And I realize I kind of just threw that term out there. Could you give a really quick description of what the female athlete triad is?
Yeah, so that's when, particularly in female athletes, if you have detriments in certain minerals and vitamins in your body, you can see things like amenorrhea, you can see reduced bone density and those types of things. And so it's making sure that you're spending time, particularly in our young female athletes, to make sure they're getting enough calcium, they're getting enough vitamin D, they're getting enough iron in their diet, so that, again, we're promoting that healthy growth and development. And making sure that they're maintaining enough energy for not only sport, but for health as well.
Great, thank you. Well, we're rounding out. We have about 5 minutes left. Did anyone else have any other questions before we close?
I just think there's a lot of information, RJ. So I just want to thank you because someone's asking for your contact info too, which was great. I can see a lot of ways of following up, both in terms of some of the basic nutritional content that I think a lot of us on the phone across different organizations and certainly at Up2Us would love to see how we can train it, how we can implement some of this with our existing training. And also, I think just how you did this, how you went through the process with us too of, the Cadillac version, the one shot version for summer camps and everything. And there's a lot of food for thought on, what some of the lessons you're learning and staying in touch with you in terms of how that's being received and distributed. So, from where I sit, thank you. That was really helpful.
No, and thank you again. Like this is an awesome opportunity to, again, put this out there in terms of what's available and get it into the hands of the smart creatives that are already doing work in these areas that would find ways to grow it and improve it in ways that I don't have that lens to look at right now. Right. I'm looking at this from part of an academic standpoint, but also part of a community health ed standpoint. And so we're creating ways and methods for it to be successful in that environment. But, you know, especially getting it in the hands of folks on this call and folks that aren't on this call that are just equally as smart and creative to say, okay, what's a better dissemination way, or, you know, what's a better way to train or how to advertise this? Absolutely. I welcome all feedback, questions. This has been truly fruitful. This has been truly exciting for me.
Thank you, Dr. Gibbs. Well, with that, we are going to close. I want to give just, again, a huge thank you to Dr. Gibbs. So if we can get some snaps, some emojis, whatever you feel most comfortable with. Thank you so much for sharing your experience and your knowledge on such an important topic, obviously. Second, we'd like to thank everyone for joining our Lunch and Learn today. Look out for our next Lunch and Learn in May. Check out the chat for some of the links and some, I believe Dr. Gibbs's contact info is in the chat as well. We'll also send a follow-up email with all of this information, with the recording of the session and everything. So once again, thank you, Dr. Gibbs, for this session. Hope everyone has a great rest of your week.
Thanks, everybody.
Thanks.
Thank you.